Namaskar, I am Dr. Asha Baxi, Lead Consultant at Motherhood Hospital, Indore. My main interest is in the field of infertility and endoscopy. Today, we are going to discuss about embryo selection. Whenever we see the embryos, we decide amongst ourselves, then the embryologist and the couple. And we discuss what is the number of the embryos and what is the quality of the embryos, and even few more things we keep in mind. What is the age of the patient and how many children she has in the past. And if we have good quality embryo, then we usually go for single embryo transfer, preferably on day 5, which is blastocyst. But sometimes we may have to insert 2 embryos also. Usually we discuss with the patient, and many a times patient is okay with single embryo transfer, and sometimes patient insists on 2 embryos, or maybe there have been failures in the past, or the embryos are not that good quality, then we put more embryos also. But our law does not allow more than 3 embryos to be inserted. So best quality embryos we select, and if rest of the embryos are there, we freeze the embryos so that they can be used in future. Oh yes, patient has always a say in everything, and I think the system should be very transparent, and everything should be selected, should be discussed with the patient. So we do discuss with the patient, we respect their wish, and if they want, we can go for 2 embryos also, and we encourage single embryo transfer also. And many a times patient feels that you freeze our embryos and we do not want them to be transferred now because of some problems, maybe they've got some carrier issues or something. So we freeze all the embryos and we may transfer them in future, maybe few years later also. And this is something which is known as social egg freezing or social embryo freezing, which is picking up. So yes, patient always has a say in everything. The quality of the embryos is single very important thing in the success of the IVF, and at the same time for future development of the baby also. So if we get a good embryo, and that is again we synchronized with a good lining of the womb which will nurture the embryo, then the results are very good. So very important that we get good embryos, though always it is not possible, but sometimes it is possible, and we try to select the best ones. One important way is pre-implantation genetic screening also. We take out some cells from the embryo and then select. So people are talking a lot about this technology. So one of our patients, she had 4 IVF failures in the past, and in that case even PGS, which is the last thing we offer to select the embryo, was done. But still she did not conceive, and then she came to us and she was wishing to go for donor eggs. But somehow we discussed with her, we encouraged her, and we said that let's try one more cycle. And somehow she herself, when she met us, she also felt that she wants to try one more cycle with her own eggs. So we did the IVF, we used a very good stimulation protocol, got embryos, took them to day 5, froze all the embryos, and then did a frozen embryo transfer in the next cycle. And to our surprise, this patient was from Dubai and she had twins, and those twins are almost 5 years now. So it was very satisfying that this is the patient who was almost about to go for ovum donation, but we encouraged her, and we selected good embryos and transferred them, and she succeeded. So very satisfying experience.